You're listening to the Health Courage Collective Podcast, Episode 9, Nitric Oxide. Welcome to the Health Courage Collective Podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Hi friend, welcome back to the podcast. I'm so happy you're here today. How is the joy of missing out going? Have you been able to transmute your feelings of desire for something unhealthy into energy that you can use to make a difference in the world? Do you imagine the black sun as you do so? Or is it too weird for you? Today, as always, we're going to talk about one of my favorite things, nitric oxide. Not from your dentist. That's nitrous oxide, N2O. Nitric oxide is NO and is remarkably different. As they say, nitric oxide is no laughing matter. I don't think anyone actually says that, but maybe we can start a trend. Did you know that your body makes its own nitric oxide and that it's fantastic? As you may have guessed, nitric oxide is a gas. Since I'm telling you how fabulous it is for you, you might not have guessed that it's a free radical, but it is. It has an unpaired electron. It is generated in nature by lightning, but in the atmosphere it's quickly oxidized to nitrogen dioxide, NO2, which is a primary pollutant in the atmosphere and a contributor to that gross brown smog look. Blech. Nitric oxide is also generated in your body, inside your arteries, nerve fibers, mast cells, mitochondria, and various other tissues. Some people naturally make more of it than others. Lucky. Dr. Louis Ignarro won the Nobel Prize in Medicine in 1998 for discovering nitric oxide. He's where I heard that nitric oxide is no laughing matter joke from, and he's 80, so it's way better coming from him. His discoveries about nitric oxide led to the drug company Pfizer rebranding a failed drug they had scrapped called sildenafil into one of their greatest hits, Viagra. Some people call Dr. Ignarro the father of Viagra, which he didn't invent, but he says he doesn't mind. Viagra's vasodilatory effects come from nitric oxide, but nitric oxide is cool in so many other ways. I hope a brief discussion about it will help you be more prepared to uplevel your health and age like a pro. Since we're already on the topic of vasodilation, we'll start there. Vasodilation just means the dilating or widening of the blood vessels, which happens when the smooth muscle of the arteries relax, allowing more blood to flow through more easily and decreases blood pressure. Nitric oxide is made inside the arteries, which helps relax the smooth muscle, lowering the blood pressure, allowing better blood perfusion of all the organs, preventing hypertension, which is consistently high blood pressure, and potentially preventing cardiovascular disease, heart attacks, and strokes. Pretty cool, right? But it doesn't stop there. I feel like I'm on a TV infomercial for what were those things? The new wave oven. But wait, there's more. Operators are standing by. This is not available in stores. Nitric oxide is also very anti-inflammatory. This is a huge benefit everywhere in your body, but especially inside your arteries. Nitric oxide helps prevent the deposition of cholesterol plaques in our arteries, preventing arteriosclerosis, and hence the need for a stent or bypass surgery or having a heart attack. This is all driven by inflammation, so having an on-site anti-inflammatory is fantastic. As we'll discuss more over the upcoming weeks and months, inflammation fuels all the important diseases. Heart disease, cancer, diabetes, Alzheimer's disease, autoimmune disease, mental health diseases like depression, chronic pain, general aging, and on and on. Nitric oxide can have a role in helping with all of these. Nitric oxide also helps prevent unwanted blood clotting without causing unwanted bleeding, the way so-called blood thinner medications do. This can be hugely important. You for sure don't want a rogue blood clot hanging out anywhere in your body. It's especially important for preventing the major blood clots we think of: coronary artery disease, heart attack, and stroke. Nitric oxide can also be released in the nerves, where it functions as a neurotransmitter. Pretty neat. It can work all over the body, but it has been shown to work in the brain in the areas that promote learning, memory, and information recall. We want to excel at all of those things, especially as we get older. There's a theory that dementia may be all or partially due to a deficiency of nitric oxide in the brain. In fact, the brain has 10 times more nitric oxide than any other organ in the body. I wonder why. It's gotta be important. Okay, remember that nitric oxide is a free radical, which is usually a bad thing? Well, it's a good guy free radical, if you will. We'll think of it like Severus Snape. Seems bad, but it's actually good. Its free radical properties are what allow it to quickly go after and neutralize other nasty free radicals like superoxide, which is really bad, or oxidized fatty acids, which are rancid fats that like to deposit themselves in arteries, or the kinds of free radicals that like to damage body tissue's DNA or promote cancer and general aging. Nitric oxide is also a cell signaling molecule, meaning it can send messages by joining with a receptor on a cell surface, triggering a chain of events that can lead to things like increased production of natural antioxidants or down-regulating inflammatory responses to irritating stimuli. In fact, due to its cell signaling properties, nitric oxide was named Molecule of the Year in 1992, which I didn't know was a thing, but apparently it was. I looked it up and it was meant to be like a scientific version of Time Magazine's Man of the Year. Molecule of the Year. Cute, huh? Makes me happy. So nitric oxide matters to everything that matters to your health. It's fantastic for your overall longevity, which is what we're after here. Our natural production goes down as we age, so it's one of the things you might want to consider supporting as you get older. To recap, nitric oxide is a signaling molecule, vasodilator, it lowers blood pressure, it's a neurotransmitter, prevents blood clots, improves blood flow in organs, prevents blockages in the arteries, is anti-inflammatory and antioxidant, it improves learning, memory, and recall, regulates erectile function in men and women, and it also protects skin from sun damage and skin cancer and helps promote proper digestion by helping move digesting foods, and it regulates digestive enzymes. Not to mention that it's also antimicrobial. It kills bacteria, viruses, and parasites. Whew. It's totally worth doing an infomercial about, don't you think? This is all great and everything, but how do we get more of it? One of the tricky things about nitric oxide is that it's extremely short-lived. It is quickly formed and quickly used up. It has a half-life of 2 seconds. It's impossible to measure in real time in the body. Most studies about it measure byproducts like nitrite and nitrate. Nitric oxide production is also highly regulated and localized, so it doesn't increase everywhere in the body at the same time, just in whatever body location it's working in that second. People with hypertension, high blood pressure, are likely to have low nitric oxide levels, and sedentary people definitely have lower levels than active people. I heard Dr. Ignaro, the nitric oxide Nobel Prize guy, say that, quote, "It is suicidal to be sedentary." And I thought, well, that's telling it like it is. And he explained that you don't have to be a hardcore athlete to raise your nitric oxide. Just moderate gentle movement is enough to make a difference, which is great. So moving your body, whether you call it exercise or not, is one very important way to increase your nitric oxide. That's enough, but if you want to take it a step further and be extra weird since we're not normal here, large amounts of nitric oxide are produced when there is a shear stress on the arteries from blood flow being restored and rushing back in after having been constricted. There's something you may or may not have heard about called blood flow restriction training, which is lifting weights or doing certain exercises or movements with cuffs on to restrict your blood flow, making the exercises much more difficult to do. It has to be done carefully and precisely, but it has a pretty extraordinary list of benefits. Nitric oxide is low on that list. It does a lot of other cool things. Let me know if you want to learn more about it. I do it. Not quite as often as I like to, but I'm working on it, and I'd be happy to share more if you're interested. Fun stuff. As you may have guessed, another way to improve your nitric oxide level is to eat healthy food. Shocking, I know. Darkly pigmented foods like beets, spinach, and pomegranates help raise nitric oxide levels. It's a little confusing because added nitrites in things like lunch meats are bad, but natural nitrates in root vegetables, leafy greens, apples, and some dark fruits are good. Nitric oxide is also stabilized by the antioxidants that come in all the darkly pigmented foods. The enzyme that produces nitric oxide is called nitric oxide synthase, and the substrate for that enzyme is the amino acid arginine. Did you get all that? So more arginine equals more nitric oxide, which is good. Most proteins contain a little bit of arginine. Nuts, especially almonds, have the highest amount, then seeds, then dairy products, and then meat. You can also take arginine as a supplement. It comes in capsules or powder, but the powder alone tastes bad. There are some supplements specifically formulated to boost nitric oxide levels. Of course, always do your own research if you're interested and think it might help you. Remember, moving your body and eating darkly pigmented vegetables and fruits is where it starts, so do that first. And like everything, it's not worth getting overwhelmed about. I've taken a nitric oxide supplement made by the company Berkeley Life for a couple of years, and I've liked it fine. It has potassium nitrate, beetroot extract, pomegranate extract, and a few other vitamins. Berkeley Life also makes these saliva test strips to test markers for nitric oxide in your body, which is kind of fun if you're into stuff like that, which I am. I don't think they're super necessary or anything, but just more kind of interesting and nice to have as an option. I've mentioned to you before that I got a tub of straight beetroot powder from Costco, so I've been adding a bit of that to all kinds of foods and turning everything I cook pink in the name of nitric oxide. That's another way to go. Another company I really like called Pure Encapsulations also makes a nitric oxide supplement with cranberry and grapeseed extracts, along with citrulline, which is an amino acid similar to arginine. There is also a supplement co-developed by Dr. Ignarro, the guy who won the Nobel Prize. I don't know much about it, but it seems like he would know what he's doing. It's a powdered arginine and citrulline amino acid blend with some antioxidants. It's called Niteworks, Niteworks. I'll put some links in the show notes. None of them are any kind of affiliate links. I don't get anything if you decide to click on them, so just do as you choose. There are probably some other good supplements, and probably some bad ones too, which can be a tricky path to navigate. Another way to boost your nitric oxide, which I love, is breathing correctly. We're going to talk a lot more about this very soon. I'm so excited. But the nasal sinusoidal passages produce a lot of nitric oxide. The mouth does not. So if you breathe through your nose, it helps relax the trachea, airways, arteries, and smooth muscle, widening the bronchioles and dilating the pulmonary arteries to undergo better oxygen exchange. And remember that NO has antimicrobial effects. So if you breathe through your nose, your lungs are more protected from bacteria and viruses than if you were to breathe through your mouth. This is beyond the scope of what will directly improve your life right now, but just for the sake of knowing cool stuff, there are currently clinical trials going on using inhaled nitric oxide to treat COVID-19. I didn't know this, but inhaling nitric oxide is not new. It's used to treat premature newborns with respiratory failure all the time. The problems that cause death from COVID are that the virus attaches to the place where oxygen is extracted from the air in the alveoli. It destroys the endothelial lining of the blood vessels, which is where nitric oxide is made, which prevents dilation of the arterioles, and it also causes pulmonary hypertension and blood clots. Nitric oxide reverses all of those problems and is also antiviral, so it actually kills the virus in the process. Kind of cool. It's hard to administer correctly. You need a very special delivery device because it's so unstable. If it's not done right, it will turn into an oxidant that could kill you. It remains to be seen what will happen with the trials, but it's sure interesting. There are currently 3 companies developing portable inhalation devices, which would work for any kind of respiratory infection, including influenza and the common cold. Maybe someday we'll all own one, and being sick with a cold will be a thing of the past. Who knows? Thank you for being here today. I hope that knowing a little bit more about nitric oxide will help you live a little better, a little longer, and give you more opportunities to make a difference in the world by removing potential limitations to your health before they start. Next week, we're going to talk about I don't want to know. Until then, don't be normal. Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed physician.